The idea is that we bring the patient to the MRI machine and we place by the side of his head a small device, a transducer. It's about the size of a teacup saucer. And we place that in a position nearby the head so that we can reach with a straight sonic beam a certain area of the brain which we think has to do with recovering cognitive faculties after brain injury, which is called the thalamus. It's a small egg-shaped structure at the very middle of the brain. So this device we place is what actually creates the sonic beam that eventually elicit and try to activate neurons in the structure we were interested in.
And
by the day after the patient had already done remarkable recovery, we started seeing behaviors that we had not seen before. For example, the patient could start recognizing objects. We could ask him to reach for one of two objects, and he would reach for the correct one. He tried using objects. He tried using a spoon, for example. He restarted trying to verbalize and could very clearly give yes-no answers by blinking. Now, remarkably, about 3 days later, I went back to visit the patient, and I thought it was remarkable, the recovery he did. He could clearly understand language. He was well-oriented. He responded with no hesitation to commands and to my questions, which means he could reliably communicate. This, to me, as a clinical scientist, is a key word, because once patients can reliably communicate, and he did so by just gesturing yes-no with his head, once patients can do that reliably, they are no longer in a disorder of consciousness. They emerge from a minimally conscious state. So in a sense, the day after our procedure, the patient was clearly exhibiting behavioral ameliorations, becoming a much higher minimally conscious state than he was previously.
Created using Powtoon.